much for being here tonight. I believe this is our 4th week in a row that we are being available to all of you for your questions, concerns, feedback, anything that you think might be relevant. I kind of had a thought earlier today and trying to figure out, a lot of what we've been talking about, seems repetitive and it's been challenging for so many of us. And I definitely found that last week for a lot of folks became that breaking point of, recognizing that when we continue to talk about that new normal and social distancing and what that means for us, I think a lot of folks were thinking, oh, this is a 6-week thing and, we're good to go back to normal. And the reality is that that's not the case. I think that has been challenging, especially as we talk about, staying, 6 feet apart, wearing a face covering in public, not going out if you're sick, really good hand hygiene and hand washing, right? Some common things that we're, probably more familiar with, in these last couple of weeks. But I did want to start off the night because I happen, as you can imagine, I'm working just a little bit on these pieces and whatnot, and I'm physically in my office tonight. And so I looked up on my board today and I was just like, what are all those sayings up there? Is there anything that I can utilize that might kind of apply to where we're at? And I think this one was really telling for me. And obviously I don't, think that everyone will, that this little, it's called the gratitude poem, that this will resonate with everybody. I think it's important, at least for me, to recognize kind of where, so many of us are at. And so I'm just gonna start that for the night. And so this is a gratitude poem. And from what I know, it's author unknown. And so basically it says, be thankful that you don't already have everything you desire. If you did, what would you have to look forward to? Be thankful when you don't know something. It gives you the opportunity to learn. Be thankful for difficult times. During these times, you grow. Be thankful for your limitations. These are opportunities for improvement. It is easy to be thankful for the good things. It's challenging to be thankful for the bad. A life of rich fulfillment comes to those who are thankful for setbacks. Be thankful for your troubles. They become your blessings. So as you can imagine, the role that I'm currently in, so many of these things resonate with me because, I don't know everything. I continue to learn daily. None of us have experienced this in our lifetime. This is a pandemic. It's challenging, right? It's challenging for all of us. And so I thought that was just a really good one for me to kind of reset. And so that's kind of where I'm at. As you guys know, as restaurants are allowed to operate or dine in, and so at a limited capacity. So that means, once again, they're able to have patrons, inside the restaurants, but there has to be 6 feet spacing between tables. There's a limitation on how many folks can sit at a table, like face coverings, are still required, in there. So if any of you are out there looking to, support our local restaurants as a dine-in option, please don't make their job any harder than it is and support them in a way that, is safe and, participating, in those places where you're face covering until you need to eat and or drink, kind of a thing. And it's not the time for socializing with folks you haven't seen across the way, because that kind of defeats the purpose. And if we, as we continue to look at the data, I'll let Lisa talk to that here in a minute. And it's important that, we continue doing as well as we've been doing so that we can continue to, responsible reopening is what we're calling it, so that you have the ability that we're all taking responsibility so that we can continue to reopen as a community. Thank you.
All right, so what I wanted to take the opportunity to do is share our data. It's been important for our elected officials as they make their decisions how to reopen our economy based upon the numbers of infections. And so I thought I would share that for you. I'd like to first share the Colorado data. And then move through Lake County data, and I'll do this quickly, but please do interrupt me if you have questions. I'm assuming that everyone can see my screen.
Not yet, Lisa, it is not up yet. Oh, it's coming up now.
Great. Okay. All right. I'm doing these updates weekly, and I certainly am happy to share this information with whomever would like me to share it with. But this is the Colorado data initially, and it shows the number of infections. You can see here that Colorado had its initial peak here at the end of April, where we had a little over 700 cases on one day, but this is where the peak was. And then this downward trending information represents what happened when we stayed at home. And then this peak, this part here is what's happening now that we're doing safer at home. And so Colorado is doing an excellent job, even through the safer at home here over the past several weeks, with not a significant increase in infections. I think everyone has seen a graph that looks like this, either nationally or at Colorado, but here we are at the portion of the curve where we have begun to flatten the curve. These are the overall total numbers that Colorado has experienced. And then, of course, this is the graph that's most interesting to healthcare providers, as we see our peak of infections happened here in April, and then the hospitalizations have come down since that time, where we're about 400 people in the hospital in Colorado on average most days through the end of May here. If you look at all of the trending data, you can see that all of them have come down, and this is clearly a function of what happens when people socially distance. So when you are far enough away from someone for whatever reason, because you're in a smaller group, because you're staying at home, because you're covering your face, you're washing your hands well, you decrease the number of people that become infected. Death data is obviously something that none of us like to look at, but it's important that we see that here again, mid to late April is when we had our peak of deaths in Colorado. And as we were very careful about our staying at home and now safer at home, we can even see that there was one day in May where we didn't have any deaths in Colorado from COVID-19. To look at what's happening here in Lake County, we can look at our testing data, and these are the number of both the PCR nasal swabs and the IgG blood test. I've combined them, and I looked at them per day. We can see we also had our peak here in Lake County around mid-April, which is mirrored Colorado. And then since then, we've seen a decrease in cases. If you look at the cumulative data, we had a lovely leveling of the curve here where we really flattened it. For almost a month, we didn't have any positive cases. But recently, over the past couple days, we have started seeing positive cases again. Certainly, as we would expect, as more people come into our community and we are exposed because we're moving around and moving about. But the most important part of this is we know that's going to happen, but we want to be careful not to overwhelm our healthcare system. And this is our hospital data of people that we've hospitalized here in St. Vincent's, and we've taken care of about 80% of the people who were sick enough to be hospitalized. 20% of the folks were sick enough that they needed to go to Denver, but our hospital has clearly been taking care of our COVID patients. We have not become overwhelmed, and we have enough personal protective equipment to be able to take care of the folks that need us here locally in Lake County. And we have to be careful that as we continue to loosen the restrictions, that we do not overwhelm our healthcare system so that we can continue to take care of the people that need it. A summary, as of the 24th of May, we've tested 114 patients with the nasal swab that has looked for the presence of the virus itself, so people who are currently infected. 10 out of those 114 people this week are the cumulative data, or 9% of the people that we have tested have been positive. And for those of you who have seen this presentation weekly, that number has come down. Initially, we were at 17% during the first week of testing. So that's good news that we are testing more people now as the denominator continues to increase. The last, or second to last slide I wanted to show was the IgG test, which is the antibody test, which looks for ever being exposed to COVID-19, at least within the last several months. As of the 23rd of May, we've tested 620 patients. And we've had 3.2% of them have been positive. And every week, so our fifth week, I think, fourth week maybe, that we've been doing this, it's been about 3%. So what that tells you is 3% of the people who we have tested, most of which who live in Lake County, have had experience with COVID-19. So they have seen the virus, they've been infected with the virus, may or may not have gotten sick, but 3% of us have gotten it. If you look what happened in New York, they did a test of 3,000 patients in New York City, and their positivity rate was somewhere between 15 and 20%. So even after what that state went through, only 20% of their population has had seen the virus and has experience with it. It does take 60% of people having antibodies in order for us to consider that we have herd immunity. So we have a long way to go. And then, of course, my favorite slide is this one. We've had no deaths reported here in Lake County due to COVID-19, and I would like to keep it that way. So I'm going to stop sharing my screen, but I'd like to know if anybody has any questions.
Hi, Dr. Lisa. This is Norm Ryder. I have a question. So are we able to tell which COVID cases are Lake County residents versus visitors?
You know, up until yesterday, we didn't have any visitors who had tested positive. So that's a great question. So we had 2 positive tests yesterday, and again, those were the first positives in a month that came from visitors. And I'll have to think about how we present that data in the future and whether it's important for us to know the difference between who actually resides in Lake County and who doesn't. My initial impression is that it probably doesn't matter because they're here. And you know, what we're looking for is trending in infectious folks. And so I don't know if it necessarily matters, but if there's enough interest, I certainly will track that separately.
Thank you.
Yes, sir.
And then I will share, as far as like contact tracing goes, you know, obviously we're aware of those cases that tested positive in our county but live somewhere else, to ensure that the folks that they were here with between counties, as this does happen, because as we know, the virus does not stop at county lines, and so we are sharing a case, if you will, and we had that happen earlier as well in this process, like with Mesa, that we were sharing a case with. So not uncharted territory in that respect, thankfully. All right, so I will keep going here, and obviously if folks have questions, please feel free to jump in. But along with the new public health order that came out from said to allow for dine-in options for restaurants at a limited capacity, we are also opening our lodging coming June 1st. We're working with you know, the city, the county, our nonprofits, and other folks that are just trying to return to work at a limited capacity as well. But otherwise, our order kind of has stayed the same. We're still limited in group size to group sizes of 10. That does not include in a restaurant, if you will. That's specifically for outside, or you know, if you're coming together in a different setting. And so that's kind of the basics, if you will, of the public order. And as of right now, as we know, for us to reopen responsibly is, there is a process in place that most folks have now understood, in the sense of any business that's been able to open since the shutdown that was closed but now able to open has been submitting their social distancing protocol. And right now, just our numbers are for retail food, we have 19 total applications. 18 of those have been approved. 1 is pending. We're actually waiting for some more direction from the state. As far as lodging goes, there's 50 total, 48 are approved. The 2 that are pending are, once again, kind of special circumstances. And for businesses, there are a total of, it looks like 72 with 60 approved with 12 pending. And the note on that is that there's a couple that I have taken on that are city and county, as far as our county offices reopening in our separate buildings. And so in that pending file, there's some of the work that I have to do here in the next day to ensure that the county has made a decision to open on June 1st in limited capacity, depending on which department it is. So that is why that one sounds like a big pending number, but it's more related to our city and county departments, if you will.
So I see a question. Does the state grant cover the cost of the COVID test, or would we have to check with our insurances? And so I was pretty solid that I thought I knew that answer to the question, but yesterday, unfortunately, the rules changed. So there are several different circumstances, and it really depends on which circumstance you fit into. And I'll just go through them briefly. Again, please interrupt me if it doesn't make sense. But the first circumstance is you have private health insurance, United Healthcare, Blue Cross Blue Shield, and you come in and you're sick with COVID. Your test is covered, as is the office visit, and it should be covered at 100%. Now, certainly if you have not met your deductible, it might go towards your deductible, and so that would be an out-of-pocket expense. But what they're telling us is that if you're sick with COVID, you should be able to get the test, the diagnosis, and the treatment under that diagnostic code. The same goes for Medicare, the same goes for Medicaid. If you are not sick with COVID and you would like to come in and get the antibody test and you are privately insured, have Medicaid or Medicare, Blue Cross Blue Shield, United Healthcare, those ones. It depends on your specific policy, and they may deny your request for a screening test, so the antibody IgG test. So certainly, if you are sick, you are covered. If you are not sick, you may or may not be covered, and I would recommend calling your health insurance. For those who do not have health insurance and have a photo ID that's either a driver's license or a Colorado identification card with a social security number, there is a grant that will pay for either the blood test or the PCR nasal swab. And again, it is supposed to be covered at 100% for those people who come in who do not have health insurance. For those who are sick, who do not have a Colorado identification, do not have a social security number nor a driver's license, you can be tested through the state public health department, and that cost of that test, the test itself is covered, not the office visit, and there might be some additional funding that we can find for that as well. But unfortunately, we had hoped that our all of the testing, irrespective of your illness, if you were well or not, insured or not, would be covered at 100%, but we are learning that not all insurance companies are honoring that. So what I would do if I were you is I would call your healthcare provider and let us help you walk through that so that we can determine if you meet qualifications or not.
And Lisa, I'd just like to emphasize that the testing sites here in Lake County are at Rocky Mountain Family Practice, as well as St. Vincent Hospital. And once again, I want to stress that anyone who is symptomatic, the tests are free.
Our next question is, can you please address the reopening of our local churches?
Yes, so currently, they are still limited to 10 people at this point in time. Social distancing has to happen. I do know that some churches have reached out, and I'm waiting for guidance from the state, as there might be a decision made on June 1st about whether or not we can expand that number. So I'm fully aware of how challenging that is, in the sense of only having the ability to open our doors for 10 people. But that is how it stands right now with the governor's public health order as well as Lake counties.
Next question, can you talk through whether you anticipate Lake County moving to phase 2, 4 to 8 weeks from the start of phase 1, assuming this is May 1st, and what would change in phase 2? And I've linked in the chat box the sort of framework that's being referenced with that question about the progression of expansion of group sizes and stabilization as Lake County moves through the recovery period.
When we talk about the blue phase, we have just started our initial reopening, which is a green circle. So for those of you who ski, it is referencing kind of what happens on a ski hill. Green circle being beginner, blue square being intermediate, and black diamond being expert. So right now we are in that initial reopening phase. And so we are, just about 4 weeks into that is when we talked on previous meetings, if we wanted to set a date, we kind of put it at May 1st as businesses start to open. We have to recognize that the businesses that have been able to open the 2 big dates don't have like a high traffic volume compared to what we're now looking at in the next week and a half, where we are now allowing dine-in options. We are now opening up our short-term rentals, including hotels, motels, bed and breakfast, hostel, all of those things. And so for us to accurately understand what's happening from what we're doing in the next couple of days will take us about 2 more weeks to figure out to see if we're remaining steady. If we have a spike, there are 5 criteria that we need to meet in order to continue moving through these phases. And one of those is, the ability for the hospital, the ability for public health to contact trace everyone that's come down with it, for us to not have an increased volume in 14 days of cases. And we recognize that we can probably handle, an increase of cases. Like even now we had 2 in 1 day, and that wasn't like, oh, we reset the clock for another 14 days. It's like, nope, didn't overwhelm us, still looking good. And, we're still working on what that ideal target number is, but recognizing too, that we're also having to watch what's happening in, surrounding counties. And if we were to move into the blue phase, which is, like I said, the next phase, the things that change in that phase is truly group sizes of 50. There'll be more opportunity for like programming and athletics and things like that. And, but sorry about that. But the thing that we have to recognize is that all of these things still have to be done with social distancing. So moving into the blue is very exciting, if you will. It increases our group size and it opens up some more opportunities, but it doesn't necessarily change that dramatically from the green phase.
If you have a question and are on the phone, you can *6 to unmute yourself.
Colleen, this is Jane. I just had a comment about the blue and green phases.
Yes, and so Jane Cole is our clinical nurse coordinator for public health.
Hi, thanks. I could see some confusion and maybe where that question might have come from. In between the green and the blue, if you look at the restaurants, I just think there's a little confusion because in the green phase, we're saying delivery and takeout only, although this was developed by the state, this form. And then the blue phase, it says with social distance protocol. So obviously we are modifying a little bit on that green phase per what the governor has also changed.
That's a great clarification, Jane. I appreciate that. I don't have that in front of me, and that's a good distinction. So, right, there is kind of a hybrid stage. I do anticipate that happening in like the next week or so, but really trying to see what happens. As we know, the governor has shared that he will announce a bunch of other guidelines that are kind of coming out on June 1st, which is only a couple of days away. and we could reevaluate at that point in time. We have to recognize that we, as a public health agency, we are bound by the governor's orders, and we have the ability to be more strict, not necessarily less strict, unless we as a community decide to submit what they call a variance. But even now, that process is changing as we speak, in the sense of a request came down today not to submit any variances, to put into a form, if you will, kind of what the big questions are and concerns are throughout the state in some of these public health orders, with the hope that we have better guidance coming out on June 1st, and that we can better align across the state, if that makes sense.
How can I tell on the website about what restaurants have been inspected and their grade?
So currently we do not grade restaurants here in Colorado. The Restaurant Association has lobbied to the state, so we don't give them a designation of A, B, C, or D, if you will. If there is a question about inspections, we do have the ability to provide that through public health. So if you do have a question around that, you can call our main line at 719-486-2413, extension 2, or you can submit that question to environmental health, all one word, at co.lake.co.us. Currently, we do not have a website that can support us posting the inspection reports. That is a hope as we revamp the website as a county. Absolutely, we're able to share that pretty well.
I wanted to share on behalf of Lake County Builder Generation that they are able to support the community through things like grocery shopping for elderly folks or compromised individuals or individuals who are uncomfortable in the Safeway environment. They also are able to provide free face coverings upon request, and I pasted in the links both in English and Spanish for those requests or any other needs that you might have. Channel them through Builder Generation and they'll do their best to meet that need. I also wanted to share that if anyone has any questions regarding contact tracing process, etc., that you can email the nurses at Lake County Public Health Agency at nurses@co.lake.co.us. And I just pasted that email into the chat box.
So
what other questions do we have? Go ahead, Colleen.
No, I was just going to share, obviously if you don't have a question or you just want to make a comment or provide feedback, we are here and available like now. So it might be easier to do that now, or, obviously you can reach out to us, either environmental health. Most folks know how to get a hold of me as well. My email is cnielsen@co.lake.co.us. Like I said, this is your opportunity, and I appreciate everyone being here. But I want to make sure that if you do have something burning or a question or a comment that, we have the ability to answer it now.
Sounds like Commissioner Marcella would like to share a brief update. So go ahead, Kayla.
Awesome. Thanks, Beth. Hi, everyone. This is Commissioner Marcella. I just wanted to give you all a brief update of what has kind of happened behind the scenes. So the way that the process works is public health works very closely with the data and our medical professionals in our community and connects with us as elected officials on what that data says and how to interpret that data, and gives us our information to assist in that decision-making process. And you know, working in tandem with navigating the public health orders and supporting public health and getting those public health orders out and information out to you. We also are working diligently behind the scenes to assess our own operations as a county and understanding what the impact on the COVID pandemic is going to mean for us as a community. So we're trying to stay up to date on things that are rapidly changing at the state level to understand the impact on a local level and understand what our budget will look like going into 2021 once we're starting to emerge out of this pandemic into a long-term economic recovery model, with the hope that this doesn't relapse in the fall and set us back further. So that information changes frequently. We meet with our legislative advocacy group, Colorado Counties Incorporated, and they give us the most up-to-date information that they have so that we can make those decisions in real time and in tandem with everybody that's in the similar situation we are. So just wanted to kind of give you that update that there's a lot of work going on behind the scenes, and we have been meeting Tuesday, Wednesdays, and Thursdays of every week. If you'd like to join our work sessions and meetings, you're welcome to do so. Our Director of Public Health and Dr. Lisa give us an update at those work sessions as well, and it's an opportunity for us to vet through some of our budget decisions and funding updates as we receive them. So if you have any questions or anything like that, I'd be happy to answer those as well.
Thanks, Kayla. Our next question is, how are you addressing things like weddings later in the summer? Do we submit a plan to host them with various options?
That is a great question, and that is a great unknown right now, in the sense that at this point in time, we're only able to have gatherings of 10, and that includes, you know, any kind of formalized event. And so, you know, as we think about what's happening and the way that we know that COVID-19 is spread, you know, we're trying to decrease those chances. We're trying to decrease people coming together in a closed environment, you know, hugging and touching and, you know, all those other amazing things that happen at weddings, right? You can imagine the challenge there is as far as what does that look like going forward. And so please know that we are not alone as a county with that concern. That has been pushed up, and we're kind of waiting for more direction and guidance to see if there's something, you know, that we can do safely. Obviously, a big piece of that is contact tracing. What we struggle with is, you know, we bring 100 people together, and if we don't know who they are, and they're not all from here, like think about if, you know, one person, you know, sat at a table with 8 people they've never met before, but they were, you know, Johnny's uncle's cousin's second time removed who lives, you know, in Alaska. We have to find Johnny's second cousin removed who lives in Alaska to figure out, are they symptomatic, are they not, and you know, and maybe Johnny has then now traveled and had been in close contact because he went to another wedding. And now, like when you think of that exponentially, how that can happen very quickly, you can imagine the hesitation at the governor's, you know, level, as well as the local level, to host, you know, larger events. And so there is a challenge there. We'll continue to update, you know, folks and venues. We know this is a concern for multiple venues. And so once we hear more, like I will definitely, you know, either through Jackie, Becca, or myself, be sharing out that information, but we really have to be mindful and understanding why that is happening.
Do you know when the courthouse is going to open?
So right now there are folks, so the But my goodness, I cannot speak today. I've been in the office a little bit too long. So the county is planning on opening on June 1st. It will not be doors wide open. Currently, folks do have the ability to interact with all of those offices, both online and or making an appointment. That will continue. We're asking, county offices that have found that what's working for them effectively, they don't necessarily have to open their doors wide open. We're still trying to stagger shifts. We're still trying to have folks work from home so we don't have, a lot of folks in our spaces. When you think of the courthouse and you think of some of those offices, there's really not an opportunity to space everyone 6 feet apart. And we want to do this well, and we want to do this safely so that we continue to be available for the community.
Can you address the fire ban in Lake County?
I cannot. That's actually not my wheelhouse at all. You would have to bring that up with the sheriff and the fire chief.
So our Office of Emergency Management Director, Kaylee Ham, just posted a link to the BLM fire ban, so you can get details there as well as the Forest Service fire ban. Any other questions or general topics that you would like to touch on tonight?
All right, well, I just want to thank everyone for being here and inputting their questions. I truly recognize what a difficult time this is. Let's have some gratitude towards each other and support each other as best as we can. And in the end, please do what you can to protect yourself and others, face covering in public, and let's all, model the way, if you will. And so thank you again so much for your time.
Thanks, good night all.
Thank you.